Hi, it's Sandy, your rec center dietitian, and welcome. Today we're going to be talking about prediabetes. So this is the natural progression of insulin resistance as your body becomes more and more resistant to insulin getting into the cells, your blood sugar tends to go up. So prediabetes is that next level. So it's a condition in which the blood sugar is high, but it's not high enough to be classified as type 2 diabetes. So in general, it's classified as a fasting blood glucose that's between 100 to 125 milligrams per deciliter. So without intervention, prediabetes is very likely to become diabetes within the next 10 years. Um, so you may have prediabetes and have actually no symptoms. And in fact, I think 90% of people that have prediabetes have no symptoms, so they don't even know that they have it. But the progression then is from prediabetes to type 2 diabetes. It's not inevitable. So just know that if you are or have prediabetes at this point in time, that you can make lifestyle changes, and certain medications may help as well to take you back to a more normal blood sugar so that you don't progress as quickly into full-blown type 2 diabetes. So you hear about the hemoglobin A1C, and that is just an average of your blood sugars over a 2 to 3 month period. And they do that by checking the sugar level in your blood cells. So your blood cells live about 2 to 3 months in your body. So when they do an average of those the average of those blood cells over that period of time, they can see what your blood sugar has been over that period of time, that 2 to 3 month period. So that is what they call the A1C, and they have a lot of different names for it: hemoglobin A1C, A1C glycated hemoglobin. So those are all some names you might hear if you're at your doctor's office. So for that prediabetes level, the A1C would be between the levels of 5.7 to 6.4. Your fasting blood glucose, again, would be a measurement of 100 to 125. And then if you were to take an oral glucose test, generally you go in and they take a fasting blood glucose, then they go ahead and administer a syrupy, sugary drink and let you sit for 2 hours. And then they want to see your blood sugar after those 2 hours be in this range of 140 to 199. It's similar to the test that they do to gestational diabetes, but for gestational diabetes, they test you each hour for 3 hours to check for that. So again, I said you may be asymptomatic. You may have no symptoms if you have prediabetes. And again, I said 90% of people don't have any symptoms. But knowing that you have it, checking those blood sugars and watching that trend can help prevent more serious complications later on if you do develop type 2 diabetes. Again, those sugar in the bloodstream thickens the bloodstream, makes those plaques easier to lay down, makes those smaller vessels very vulnerable to heart disease, and also those vessels that go to the eyes, the fingers, the toes, the kidneys, those all become much more vulnerable to having damage. So prediabetes, if you do have symptoms, you might be thirstier than usual. And in fact, I have a girlfriend that's a nurse, and she said that she noticed with her husband that they'd come back from their walks and he would drink a half gallon of grapefruit juice or a half gallon of orange juice. Basically, he wasn't getting any energy to his cells. So the sugar was all sitting in the bloodstream and not getting into the cells where it needed to be dispersed to give him energy. And so he was drinking a lot. So that might be a first clue. You might also be going to the bathroom a lot. Your vision could be blurry. and you might feel more tired than usual because, again, you're not getting that energy to the cells where it needs to go. So prediabetes causes and risk factors. So if you are older, and they're calling older over age 45, so you're at a little higher risk of developing prediabetes. If your waist circumference for a male is over 40 inches, or for a female is over 35 inches, that puts you at higher risk. If you eat a lot of red meat and processed meat, if you eat a lot of drink a lot of sugary beverages, and if you don't eat much of these healthy foods, such as fruit, vegetables, nuts, whole grains, and olive oil. So those are some clues to some healthy foods you can eat. Again, that puts you at higher risk. If your ethnicity is African American or Native American, Latino, or Pacific Islander, you are also at higher risk. If you carry that weight around your center, what we call visceral fat, that puts you at higher risk for prediabetes. Also having high cholesterol, high triglycerides, low HDL, that healthy cholesterol, and high LDL, that lousy cholesterol, put you at higher risk. If you're not exercising, exercise burns blood sugar, so it's really good to get some exercise in. And they even say that walking, before or after a meal is really good for people with insulin resistance or prediabetes, because that can help to burn some of that blood sugar and take it back down to a normal level. If you had gestational diabetes during your pregnancy, or a baby that was more than 9 pounds, you are at higher risk for developing prediabetes. If you have polycystic ovarian syndrome, that PCOS, a risk factor for that, or a component of that is insulin resistance, so that does put you at higher risk for prediabetes as well. If you have certain sleep problems, so if you have sleep apnea, or you work changing shifts or night shifts, so anything that throws you kind of metabolically off balance, that can contribute to a higher risk for prediabetes. If you show those signs of insulin resistance that we talked about in the last video, which were the dark coloring under the armpits, skin tags, again, all the metabolic syndrome symptoms, so the cholesterol, blood pressure, all those things would be some symptoms of developing prediabetes as well. And also you're at higher risk if you have a parent or sibling with type 2 diabetes. So like I said, it's not inevitable that if you have prediabetes that you're going to go to full-blown type 2 diabetes. So you want to start as soon as you realize that you are becoming insulin resistant or pre-diabetic, changing your lifestyle, changing the things that you're eating, and maybe getting some medications as well in there to help prevent going to that full-blown diabetes. So research shows that you can lower your risk for type 2 diabetes by about 58% by losing about 7% of your body weight. So for example, if you're a 200-pound person, losing about 15 pounds can help bring that blood sugar down. Exercising moderately, so brisk walking, 30 minutes a day, at least 5 days a week. Again, several minute walks right before or after a meal could also be helpful. So you might want to do 10 minutes before each of your 3 big meals of the day, and that could help with that blood sugar as well. And they also say that having a family or supportive friend, a partner, can really help in helping you make those changes, and helping with scheduling appointments, helping you keep up on all of the healthy things that you need to do to keep that blood sugar down. And I always tell people, don't fret if you can't get back to an ideal body weight. That's not necessarily where you need to be, but just losing 10 to 15 pounds can significantly lower that blood sugar. So that's all I have for this presentation. Our next presentation next week will be on type 2 diabetes. You will also see a video on reducing red and processed meats. Thanks for joining.